Come in. Hello.
Hi, my name is Elizabeth. I'm the student nurse here. I'm going to be conducting your health assessment today, okay?
Okay.
Can I have your name and date of birth, please?
Elsa Apollo, 310-2000.
All right, and then I'll just confirm on your ID band. Okay, great. How are you today?
I'm good. How about you?
I'm good, thank you. I'll walk you through everything just so you kind of know what I'm doing, and then I can explain any questions that you might have. Do you have any allergies I should know about?
None that I know of.
Okay, and then are you experiencing any pain today?
None at all.
Okay, and then may I call you Elsa, or do you have another name that you prefer?
Elsa's okay.
Elsa's okay? All right, so I'll just provide some privacy for us. All right, so if you could please swing your legs around, and is it all right? I'm gonna be palpating and listening to your back.
Yeah,
Is it
go
okay
ahead.
if I touch you? Okay. And then I'm just gonna bring this down a little bit. All right, so I'm gonna be palpating your back, and I'm just going to be seeing if there's any places that are tender. Just let me know if anything hurts, okay?
Nothing hurts.
Nope, okay. And then I'm just gonna examine your back. Skin looks intact. I don't see any lesions or anything out of the ordinary. I'm just going to look at your side profile and just make sure everything's proportionate, which is good, because if it wasn't, then we would look more into your lungs to see if there are any issues we should be looking into. But I'm just gonna listen to your lung sounds now, okay?
Should I breathe like normally?
Yeah, breathe normally, and then every time you feel my stethoscope, just take a deep breath, and you can breathe through your mouth, okay?
Okay.
All right. All right. And I listened to 9 spots on the back. All right, and then if you could swing back around for me, please. All right, and then if you wouldn't mind just draping back down. I'm just going to be checking your respirations, making sure they're not labored, just assessing the skin on the front, making sure there are no lesions or anything out of the ordinary. And now I'm going to listen to your lung sounds from the front, okay? There's going to be 6 spots I'm going to be listening to. So just breathe normally again, okay? Okay. So sorry.
Is it in your way?
Okay. And then now, if you wouldn't mind reclining for me. Okay. And let me bring this up for you. Okay. I'm going to be checking your carotid artery pulse, okay? Okay. All right, and I feel it normally on both sides. And now I'm going to be listening to your heart sounds, okay? So first I'm gonna palpate your apical pulse, which is right under your breast area. So if you could lift your breast for me, please. Alrighty, on the pulse. And then now I'm gonna be listening to your heart sounds.
Do you want me to learn this?
Yes, please. Alright, so first I'm going to I'll go to your sternal notch, go down to the second intercostal. So that's the second intercostal right sternal border for the aortic valve. Then I'm going to listen to the second intercostal left sternal border for the pulmonic valve. Then I'm going to go down to the third intercostal, left sternal border for Erb's point. And then fourth intercostal, left sternal border for the tricuspid. And I'm going to go fifth intercostal midclavicular line for the mitral valve. Okay, and then if you could roll over to your left side for me, please. All right, and I'm going to listen to your apical pulse. And that's right where I listen to your mitral valve. Okay, perfect, and then you can go back over for me. Now I'm just going to listen to everything with the bell of my stethoscope, and I'm just listening for heart murmurs, okay?
Okay.
So we're gonna go second intercostal left sternal border again. Or right sternal border, sorry. And then second intercostal left sternal border. And that was the aortic over here, pulmonic over here. Third intercostal is Erb's point. Fourth intercostal is tricuspid. And then the mitral is the fifth intercostal. Okay, perfect. Now I'm going to be palpating your pulses. So I'm going to palpate your radial pulse for 30 seconds, okay?
Okay.
I'm just going to wait for it to go. Okay. And go. Okay, 68 is your pulse. And then I am verbally going to palpate the femoral pulse. And then we're going to go to dorsal pedalis. And then we're going to palpate the tibial pulse here. Okay, perfect. And then next I'm going to listen to your abdomen, okay? So listen for a minute each. Yes, please. All right, and then can you point to your belly button for me, please? Okay, perfect. Okay, bow sounds are present in the right lower quadrant. Okay, vowel sounds are present in right upper quadrant. Okay, vowel sounds are present in the left upper quadrant. Okay, and vowel sounds are present in left lower quadrant as well. I'm just going to palpate it, just let me know if anything hurts or feels tender, okay?
Okay.
I'm starting in the right lower quadrant. I'm going in a circular motion. Any pain?
No. Okay.
What about now?
None.
That's the right upper quadrant, left upper quadrant,
No.
and then left lower quadrant.
No.
Nope. Okay. That concludes my health assessment. I'll help you up. Do you have any questions for me?
No.
No? Okay. Well, the provider will be in shortly. And then if you need anything, the call light is to the side of your bed, okay?
Okay. Thank you.
Of course.